So in terms of experience of the program, I wasn't quite sure what to expect when I signed up, but I'm so glad that I did. The program itself is split over 5 days, a mixture of on-site and in-person. And what was really, really nice about it is meeting people that are involved in digital delivery or delivering digital services to people across Wales in roles that maybe we wouldn't get exposed to, or I wouldn't get exposed to, being primarily healthcare focused. So talking to people in local authorities around some of the digital enablement projects that they're doing, and also understanding from a range of leaders across the public sector in Wales what they're doing to deliver better digital services. Why were the connections that I built on the program important to me? One, I think kind of that natural kind of human contact with other leaders across the public sector is really, really valuable, because you're able to have quite organic conversations about different challenges. And what's really interesting, or for me at least, is across all of those connections that are built over the course of the program, is there's so many shared challenges, and so many of us are almost kind of dealing with the same challenges, the same problems to solve across that sector. And it's really, really useful, particularly as we started to ideate on some of the problems that we identified as a group, how we might build some of those solutions together. And it's also really, really useful to build up, I think, a network of connections, particularly in my work, because some of my work is community and local authority focused, with leaders in those areas across Wales. So within our community of practice that we run for service ownership, one of the first things I did was give an overview of some of the learning I'd had on the course, specifically around how we might start to think about applying the digital service standards for Wales to our services. And then also just some of the broader frameworks that I think the course really equips you with. So actually starting to look at patterns rather than tasks, starting to see where we might have repetition across our services, or where we can reuse things. And one of the other things that I found really useful, particularly in terms of some of my engagement with our new VCD team, is actually starting to understand how some of the work that I've been doing on some of the services that I'm responsible for, specifically our vaccination service, might be able to scale, and we might be able to start to apply some of those learnings as reusable service patterns to other services. And we've actually just started doing that now with our pharmacy service, but we're looking for more opportunities to do that, which is really, really exciting. In terms of the benefits of service patterns, it creates reusability across the organisation. I think we all know as a public sector how strained we can sometimes be. So actually being able to reuse patterns time and time again is really, really, really useful. I think it also takes us out of thinking, oh, I just need to do this, and then I just need to do this, and then the job's done, to actually thinking about outcomes, specifically patient outcomes, and how we actually measure the benefits of our service in terms of outcome measures or OKRs, those kind of techniques, rather than just, okay, we've completed all the tasks we said we'd do, so we're complete, and actually starting to implement continuous improvement across our services and keep doing discoveries and alphas to make sure that we keep meeting problems that we have. For me, one of the biggest barriers sometimes, particularly with some of the agile ways of working, there can be a cultural pace mismatch between policy and governance and our desire to start sprinting and ideating things really, really quickly, demonstrating prototypes. Following on from that, one of the challenges that we have as an NHS is clinician time. It's really, really important that we have clinicians involved in our services. But understandably, their main responsibility is to patients, and actually being able to include clinicians in our prototyping processes can be a challenge. So we need to think really far ahead. If we want to go out and start prototyping something, then we might need to start 6 weeks out so we can secure that time, and also making best use of that time. That's really, really precious to us. So that's one of the challenges. And I think the other thing then is how we can embed more agile governance principles within our existing governance. And I think that's a challenge that, speaking to people on the course, is quite common. And actually, for a lot of organisations across the public sector in Wales, it was really interesting to discuss some of the challenges in terms of going from traditional IT or technology organisations to actual digital organisations with a focus on building digital services with the user first, rather than technology-led services where we're just moving to the next set of technology because that's the update cycle and that's what we do. And the course is really, really useful, I think, in being able to share some of those shared challenges across the system, but also in terms of building connections with other people that can help change some of those challenges and some of those systemic issues. In terms of embedding agile governance principles, one of the things that we're starting to see is that a lot of teams aren't used to 2-week cycles of work where you commit to doing something and then you come back in 2 weeks and you do a show and tell and you say, well, this is how we've got on. I think there's still a desire in lots of areas of the system to see really long, rigid plans with really clearly demarcated milestones and deliverables. And actually what we want to get to is actually focusing on value and delivering value really, really quickly, and understanding that this prototype that we're showing you today is not perfect, but we're going to get feedback, and in 2 weeks' time, we'll show you something that's just a little bit better, and keep working through that and understanding that we're going to continually invest in teams and products to make sure that they meet user needs rather than just fixating on rigid milestones. So in terms of working in the open, one of the challenges that I'd found, particularly earlier in my career, is actually showing people what we're doing. Because one of the things that I've always thought is everyone's working really hard, everyone is doing really, really good work, but actually how do we bring that to life and how do we get people to inspect that work? Because frequent inspection is going to lend itself to better products and better services in the end. So allowing people to be part of that creative process where we are creating products and services that the people that are ultimately going to use them feel part of the process. But also in terms of breaking down some kind of organizational silos, not just within my own organization, but across the wider NHS and public sector. So one of the things that I do now is we have a release plan. So our 3-month roadmap is we make that available to anybody that wants it. I put a link in my email signature. We signpost it through any of the show and tells or meetings that we do, so everyone can see what's coming on the roadmap. One of the other things that the course really made me think about and made me want to do is actually be more engaged on things like LinkedIn. So one of the things I now do is the notes that I send to my team every week, I now put a version of those on LinkedIn, just so people can see what I'm up to, what my team are up to. And I think there is a link between that and being actually really proud of the work that you do as well, because I'm really proud about what me and my team do and what my organisation do. And actually, one of the things that the course did was encourage me to say, well, share that. I think sometimes some of us think, well, can we share that? Or should we be sharing that? But actually, yeah, do it. And what's really noticeable to me as well is the amount of people that have got in contact with us, either off the back of some week notes that went out, or we're trying to do more blogs that we issue to the public through our DHW website. I did one last year on the progress of the Welsh immunisation system, but people have actually said, oh, you're working on that as well. And that's really, really powerful, because we're then able to create really tangible connections with people on shared objectives or shared pieces of work. One of the things that we're now doing within my organisation and our quality team are doing is actually looking at how the digital service standards for Wales apply to some of our internal governance and our internal policies, and actually making sure that we can meet those criteria. And what I've now found is, within my own organisation, I'm subject matter expert for some of this stuff, that we discussed over the course, particularly the digital service standards for Wales. And one of the things that I'm now doing within my organisation is leading a service ownership community of practice. Service ownership being one of the only job description or job role that is within the digital service standards for Wales, and actually understanding how we take all of our products and services and actually visualize them as end-to-end coherent services that aren't just digital, but will have a number of touch points with patients and the public, and how we better visualize those and how we better map out pain points to make our services more accessible and more user-friendly. Did the program meet my expectations or challenge or change my approach to digital leadership? I'd say, in answer to the first question, I didn't really have an idea of what to expect from the program at first, but I'm really glad that I applied for the program, because it definitely challenged me. I think one of the things that it did was it allowed me to step back from my kind of day-to-day preoccupations, which is, digital within not just NHS Wales, but specifically within Digital Health and Care Wales, and actually start to make connections with other leaders about their challenges and their problems. And it really allowed me to step back and then start to think about my impact, not just, as a leader of teams and, the particular products and projects we're working on, but actually my impact in terms of overarching service provision, in terms of all of the steps, particularly in terms of things like digital inclusion. And one of the things that I'm now doing more is asking more open questions about what are we missing, how do we get more voices into our conversations, and really then again leveraging the connections that we made over the course of the course to try and get better outcomes. So what advice would I give someone thinking about applying to the program? I'd say just apply for it. Don't worry if you don't think you've got experience. You might not consider yourself a leader. You might be very, very early in your career pathway. You might actually be really late in it. There is no right profile for the program. As long as you're passionate about your role and the impact that we can have as a public sector, I'd advise anyone to apply for it. On my cohort, we had all sorts of folks from across the public sector in Wales, some of whom had been working in the public sector for, I think, up to 40 years, some of whom have been in for a couple of years. And all of the insights were just as valuable. I'd also really encourage folks within the health sector to think about applying, because it's really, really, really useful in terms of starting to visualize our public-facing services and our impact across all of our contact streams within the health sector. And I'd also just say it's a fantastic way to meet other similarly minded people and building some really, really strong connections. So I would just encourage people to do it.